How do you see that purpose of, we talked about helping others. You see the sectoral purpose of aged care and disability and the mental health sector. How is that aligned with that organizational purpose?
Yeah, so I see them really well aligned. So when I was at Anglicare Southern Queensland, which was a really great organisation, really enjoyed working there. That was aged care and disability predominantly. And I guess really is just the similarity there and at Richmond in mental health is we're trying to care for an individual, person-centred care of what does the individual need, but in the context of their family.
Yeah.
And that's how you make a real and lasting difference in a community, is one life at a time. So whether it's aged care, disability or mental health, I guess what I found the similarities, we're putting people at the centre and we're responding to their need and trying to help them and assist them on their journey, whatever that may be.
And have you been on a journey of when organizations change, funding models change, organizations go through a large change journey? And they have to rethink their purpose, the reason to being, what is more important, dollars versus service delivery, all of those basic qualifying questions, and the board and the chair and the CEO has to come back and realign to the new value systems and look for a new culture. So have you been on any culture journey?
Yeah, definitely. When I became CEO in 2018, we went into a new strategic planning process.
Yeah.
And for a period of time, the board had been considering branching into more broader aspects of healthcare or community services. It could be AOD, disability, a whole range of things. When I became CEO and we went through that process, I was really clear that I thought it was the best thing just to stay only mental health. So we only provide mental health services. We are a true mental health specialist agency. We do not do anything else. And I guess the realignment for us is to say, okay, if we're going to do, what's the reason for that? And the reason for that is if you're caring for the most unwell people in the community, which is what we do at Richmond, we do real pointy end services. That requires a lot of expertise and a lot of focus. And I didn't feel that we could provide the best quality service with the expertise required in mental health, whilst also trying to be really good in lots of other areas. I just don't think it was possible for the size of the organisation at the time. So the other thing then is to say, in the work that we're going to go for, how are we going to determine where we're going to look to expand? And I was really clear that we only go for tenders if I can look in the mirror and honestly say to myself, Richmond Wellbeing is the best placed organisation to provide that care.
Yeah.
And if I can think of any other organisation who I believe can provide a better quality care than us, I don't go for it. And I would happily call the CEO of that agency and say, we're not going to go for it. We think you'd be a great lead. Now, I have these conversations regularly with people and I'll say to them, look, I'm happy to help. If you think we can add some value, happy to help. And then the next part is whether we get roles funded in that is irrelevant for me. So and because it's easy for us, especially as CEOs, to say, oh yeah, we put the need of the community first. That's easy to say that. But my belief is that where the rubber hits the road is in these decisions where we can't say we're community focused and we're client focused if we go for tenders where we're not genuinely the best placed people to go for it. And then if we're really client focused, we need to be able to say to other CEOs, I'll support your bid and we'll add to that, whether it's funded or not, because that's actually putting the clients first.